case study number 10. So two things that might have precipitated CW's GI bleeding includes the duodenal ulcer with the clot and the warfarin mixing with the diclofenac, both risk factors. From his assessment and history, signs and symptoms of the GI bleeding can include the dark red diarrhea. It's basically blood and stool mixing. He's dizzy and disoriented. Low blood volume, less blood getting to the brain. His blood pressure is 70 over, can't even hear it. Low blood volume again. His pulse rate is high. That's because of the low blood volume as well as the heart trying to compensate for the low blood volume. It's trying to work harder, so it's pumping faster. The most serious complication that can occur from GI bleeding is, aside from death, is shock and a heart attack because of the decreased blood flow. The decreased blood flow is obviously less blood getting to his vital organs, the brain, the heart, the lungs, all of that, as well as a heart attack because of his previous cardiac issues. That would be something that I would be looking at, as well as all the cardiac issues that can arise. As far as electronic charting, I'd be documenting abnormal under neurologic for he's disoriented, he's weak, he's sleepy, he's arousable, but he's sleepy, and he's anxious. Cardiovascular, he's tachycardic, his blood pressure is low, he's got the S3 and S4 sounds, he's just not doing too well with the cardiovascular. GI, obviously, you have the diarrhea, the GI bleeding itself, that's frank blood that you can see, and diarrhea in itself. GU, I'd say abnormal as well, just trying to figure out that urinary output and that it's low, as well as psychosocial because he is very anxious. I would mark that too. As far as interventions for his renal function, that includes his crit and his BUN, but also his urinary output and the blood test, CBC and BMP. For his mean arterial blood pressure, you would do that doing the systolic plus 2 times diastolic divided by 3. His is 67.3. It's basically the average pressure in the arteries per cardiac cycle. Looking at his lab results, one that causes most concern is the hemoglobin. Shows significant blood loss. With these lab results as well, as far as a diagnostic test, probably an EJD to make sure there's no other form of bleeding. And looking at the ECG strip and the electrolyte imbalance that I would see is looking at that higher T wave, the elevated potassium. And as far as the BUN and crit, where are they elevated? You're losing a lot of blood, dehydrated, your kidney functions are going to try and work harder to compensate for it. So their levels are going to go up. And what do the low hemoglobin and hematocrit levels indicate because of his blood loss? Basically just means that losing a lot of blood, and the warfarin is causing it, the blood clot, and just all of those are kind of mixing with it. What is the explanation of the prolonged PT-INR? And those are prolonged, it's taking longer to clot. So another thing that we have to do is probably hold that warfarin in order to help stop the bleeding right now. What will my response be for the prolonged PT-INR for the select all to apply? I chose A, B, and D. What safety precautions will I do because of that prolonged PT-INR? And I think a lot of it is fall precautions, making sure that he's got his bed alert, he's got his call bell. We don't want him getting up. We also want to not do any injections unless absolutely necessary. All appropriate stuff. As far as the elevated WBC count, stress and an inflammatory response can act up because of that. The purpose of the fresh frozen plasma is for the clotting and the vital proteins for that. His fluid balance, and if it's positive or negative, it's positive. His fluid balance was 4 liters, And why will you want to monitor his fluid status very carefully? I think because of his history of the cardiomyopathy and the heart failure, we really want to make sure that we are definitely monitoring that fluid balance, because as much as we want to fill that fluid and help that regain all that fluid, we also want to make sure that it's not too much that's going to affect his heart. So it's trying to maintain that balance. 6 things that we will monitor for the fluid balance: urinary output, his blood pressure, his intake, monitoring his labs, his weight, and I would say respirations. Um, 5 things that we want to do to make the wife comfortable is, I'd say, gentle conversation, reassurance, as well as updates, simple medical, or excuse me, simple terms, so she can understand, not all this medical jargon. Maybe even offering some pillows, some blankets, or some drinks when we have a chance. Just something, when a family member is not feeling good. Um, they don't think about doing normal stuff for themselves, so you may just want to kind of help that. And then, what assessment finding would support his condition is improving? I believe I chose less drowsy and more alert, so A, as well as his oral temperature maintaining at the 98.9. And then the others were not really effective, and the last one was kind of unrelated. And that's the end. Thank you.